Hello, this is Glenda with AKA GK Fralin, a friendly community. And we have Carla is home. I told you that yesterday. And I put a request out for anybody who wanted to talk about an experience they have had with stroke in their family or for themselves or anything like that. And so tonight I'm just going to read those comments, and then I'm going to let you know about a site that I'm going to be taking some notes on maybe in the next couple of days and give you more information, because this site that I found, I feel, is the best site that I have found so far. Anyway, for the comments that were made on the after watching the vlog about stroke, I will start out with reading Carla's, because she's the one who went through this thing. And our hearts are all still with her. A sweeter lady I've never known. And she's tired. So she's a small stroke on the left side. Got to hospital by ambulance. She tried to drive, but her right eye was woofy. I'm sure that means it was blurry, or, something wasn't working right with her right eye. And generally with a stroke or anything with the brain, whatever happens on the left side of the brain affects the right side of the body. Okay, she went home. She called Glenda, that's me, and then she called her daughter. But her daughter was too far away, so she called 911. So she did go to the hospital then, and the MRI did show a small stroke. She got quick help, which helped. Numb lips and right eye went weird, but the eye is back to close to normal. The lip is still a little fuzzy, but she's home, and she's catching up on her sleep, and she's good, but it scared her, and we don't want her too scared, but she's taking it seriously, and that's good. And that's something we all need to do, and that's why we're going to be doing some more vlogs about stroke, kind of like we did with the COPD and other things. Educated is the best way to go. Okay, this is from Robin, and she worked as a CNA for quite a long time, I take it. And she says, as a CNA, I have taken care of many stroke victims of all different degrees. But on a more personal level, my cousin had a couple of mini strokes at the age of 49. She is fine now, but it affected her speech for a while. She had been taking a very low dose of a blood pressure medication, but at the time, she had some very serious stressors going on, and the combination of the two was what caused her mini strokes. So at any age, she warns, at any age you can have a stroke, and that's true. They warn about it on blood clots a lot of times are what are involved with strokes. And they even on birth control pills, they warn about, the possibility of forming blood clots. It's not frequent that it happens, but it can happen. I asked Robin if she thought it might have been what we call TIA, or transient ischemic attack, which is, it's what it is it's an interruption, a very short-term and transient or not lasting interruption of the flow of blood to a small part of the brain. And generally, whatever effects a person has from a TIA, that is usually gone within 24 hours or less, and they're back to normal. So, but it is a warning sign. So, but she said no, these were actually mini strokes, because it took several months for her cousin to gain her speech back. But she hasn't had any problems since. Anyway, Glenda Wilson, she has her grandfather. Okay, I'm going to start that again. Glenda Wilson comments that her grandfather had a stroke, and he was paralyzed and couldn't talk at first. He went to therapy and could soon talk, enough to understand him anyway. He could walk a little with the walker, and it affected his mind, but later on it cleared up, and he could remember stuff. He lived a long time after that, but he did pass away due to heart failure. He had a pretty tough time of it. Okay, yes, and she's right here. She says they've come a long way since then. And they have. I don't know how long ago that her grandfather passed away, but I imagine it's been a few years. And she's, I believe, about my age. Robin reminded us, strokes are not only old people. They're not only because of blood clots, although that's a lot of times caused. They can also be because of other things. They don't only happen to older people who have clogged arteries. They can happen for a lot of reasons. And there's different kinds, like with the TIA. And the TIA, or transient ischemic attack, the word transient tells you it doesn't last a long time. It's very short-lived, and the effects are gone within a day. Generally within a few hours. But they're a warning sign. So if someone's having these TIAs where it's affecting their speech or whatever, then they need to act. They need to, call their doctor, get to the hospital. Generally they're going to be diagnosed with a TIA, but they'll also find out the reason. That's going to be the main thing, is to find out the reason they had it. Okay, and I know I'm kind of hit and miss tonight, because I didn't script this out, except that I read the comments. And I did do some research, but I've had a bit of a rough day. I'll just come right out and say it. It's not anything serious. I had a stomach problem earlier in the day, and I just kind of felt bummed today. Just kind of like the goomph has been sucked out for some reason. But it's not like I'm sick. It's just kind of one of those days where you're just not as much up to par as usual. And we all have those, even without COPD, But anyway, so that explains a little bit of why I'm a little not so on my game here. But the fact of the matter is that this is something to be taken seriously. A stroke, or anything that acts like a stroke. Get in, find out what's going on. Carla did. She got in, and she found out what was going on. They treated it. They put her on the correct medication. She's home now, and she's resting. And that is the most important thing, is that she is resting. She slept a lot. That can be expected. Okay, Carla, we are glad you rested. We hope you continue resting. That's what your body needs. That's what your brain needs. And it's something we could all use. Anyway, real quick, before we finish for the day, I am going to go to that site I was talking about. It's called the National Stroke Association, and it says Hope After Stroke. But it also gives information, under the We Can Help. It talks about survivors, and there's several headings. of if you've just experienced a stroke or if you're having stroke recovery. And then there's information. It just links to all different kinds of information here. There's caregivers and family, and under that is the guides and things to follow, and healthcare professionals and stuff. Then there's understanding stroke. This is where I think is going to be the most important thing for me to talk to you about, is going to be what is a stroke. A hemorrhagic stroke, an ischemic stroke, a TIA, stroke facts. Those things are going to be important. Also, the understanding part of it, because people need to be listened to if something just doesn't feel right. And there's ways to, recognize that. And that's another heading here, is recognizing stroke, preventing stroke, in the impact of a stroke, stroke resources, and getting involved. That would be getting involved with their association or in some other way. And that is www.stroke.org. And so I'm going to be going through some of that over the next couple, at least over the next vlog, maybe a couple. So this is Glenda, and it's been a day, and I am looking forward to another one tomorrow, and looking forward to hearing from all of you. And it was great to read. It was great to see all of the response today in the comments to people about people's experiences with stroke. And I myself as a nurse dealt with it a lot. I dealt with a lot of stroke patients, and I dealt with a lot of it, and like Robin said, from all different kinds of, degrees. I had a grandmother who had the mini strokes, but they were continued. They continued. And so it did affect her memory, and on the long term, over time. So anyway, but that's where we're going to go. We're going to go with that. And tomorrow's another day, and so I will see you then. Good night.